Okay. So good morning, everyone, and welcome to this training session on gathering information from patients about social determinants of health. As I mentioned before, I'm Dr. Lisa Cooper, Director and Founder of the Center for Health Equity, and also excited to be one of the multiple PIs with Dr. Deidre Cruz on MATCH, the Mid-Atlantic Center for Cardiometabolic Health Equity. So today, what we hope to achieve is that after reviewing the assigned lecture that you all were assigned to watch and participating in this session, that you will all be able to define relationship-centered care, describe patient-centered communication behaviors, be able to define what structural competency is, and then demonstrate the ability to assess patients' social needs using patient-centered communication and motivational interviewing skills. So I know many of you had the opportunity to watch the lecture ahead of time. So here are some of the key terms that were introduced during that lecture. Hopefully this all sounds familiar to you: relationship-centered care, patient-centeredness, and structural competence. And we're going to go through each one of them, but I will give you the opportunity to chime in, later on in the lecture with some of your thoughts and impressions about what you saw. So just as a refresher, relationship-centered care is a framework for conceptualizing healthcare that considers the personhood of patients, clinicians, and all other participants in healthcare. And when we say personhood, what we're talking about is all the things that make people unique, right? What makes them who they are, their beliefs, their values, their background. And so we are each individuals, and we have life experiences that we bring into the work that we do. And just like patients have their stories, we have our own stories too. So relationship-centered care is care that basically considers all of those things, like who are we, who are our patients, not just in terms of the illnesses they have or the work that we're doing in the setting, but how do all of those other aspects of who we are influence our relationships. Okay, next slide. The other key term that was discussed in the lecture was patient-centeredness, and that is providing care that is respectful of patients and responsive to their individual needs, preferences, values, and assuring that the values of those patients and research participants actually guide all of our decisions. So the slight difference between patient-centeredness and relationship-centeredness is that relationship-centeredness considers basically everyone who's involved in the care process. And then the patient-centeredness piece is really when we're actually focusing more on what the patient really wants and needs. But that doesn't mean that we forget that that we actually are who we are, and who all the other people are that are involved in the care process also influences the care. Okay, next. So the next concept that I discussed in the lecture was structural competence. And many of you may have heard the term cultural competence, which is always, has been used frequently to talk about the fact that, we ought to consider people's cultural beliefs and values when we are delivering care to them, and that our healthcare systems should actually be reflective of that as well and responsive to those cultural needs. But structural competence is a little bit broader. And this concept it's basically the understanding that it's not only about people's individual beliefs and their culture and their background and values and that sort of thing that influences their health, but it's also about broader societal factors. So structural competence is about us being able to understand how health inequalities are driven by other forces outside of individuals. So institutional kinds of issues and societal level issues, and that we're actually able to take those kinds of factors into account when we're delivering care. So we're not just thinking about the patient as an individual, but we're thinking about the broader context that influences their life, right, and their health. So these are like the really critical concepts that were discussed in the lecture. And then next, we did actually talk about what some patient-centered communication behaviors look like. And so these are kind of the behaviors described in somewhat technical terms, but I think they'll be familiar to all of you who are have lots of experience working with clients and patients and research participants. But basically, when we're communicating with the people we're serving, we're gathering data from them, right? We're building relationships with them. We're activating them and working in partnership with them. And then we also are educating and counseling them. So those are kind of the 4 broad categories of behaviors. But when we want to be very patient-centered, we want to focus in the data gathering part. We really want to focus on using more open-ended questions. And we're going to talk more about that next. And what we call open to closed cones is like, for example, an open-ended question, which you're going to hear much more about soon, is when you see someone and you say, hello, like, how are you doing today? So there's an opportunity for a person to talk more about how they're feeling, or how can I help you today? And then the idea is that you start out with an open-ended question to just get the conversation started. And then you might proceed more to more closed-ended questions. Like if you say, well, how have things been going with your blood pressure management? That's an open-ended question. But then you might move close to saying something like, have you had any problems with the medications that you're taking? And that's like more of a closed question. So the idea is you want to balance those things. And you also want to balance questions about just medical issues with things that are more about the patient's overall life. So that's the idea of being more patient-centered, is doing that when you're gathering data. And we're not going to go into a lot of detail about the other behaviors today, because we're really focusing on the gathering data piece. But I know you all are going to be really thinking a lot about the relationship building portions, the activating and the educating and counseling patients. And we hope that, we will have some more sort of in-service sessions with you where we can delve more deeply into those behaviors. Okay, so next slide. So I just want to link some of these concepts to what you may have been learning from when you've done your motivational interviewing skills training. And so quick question, has everyone done motivational interviewing skills training? You can put the answer in the chat if you want. Have you worked with Arlene Dawson yet? How many people have actually done that? Okay, so the linked studies have done that. Great. So if you've done that already, motivational. Okay, it looks like Healthy for Two as well. Several of you say you have. That it's a collaborative conversation style, right? And the idea is that you're basically working with someone to strengthen their own motivation to make a commitment to make some sort of change that will positively influence their health. So Marquita says she hasn't done that training yet, but has done it previously. Okay. Yeah, so we know that you've had some exposure to this. There is a link between patient-centeredness and motivational interviewing, in that a lot of the concepts are similar. So if you go to the next slide, these are some of the basic, sort of principles of motivational interviewing. And so in order to sort of have a collaborative conversation with someone, we sort of use these, what's called ORs, right? To remind us of what some of those key behaviors are. So open-ended questions. Again, I told you we were going to come back to that. Affirmations, reflections, and summaries. So if you'll recall that from the previous slide, we talked about patient-centered data gathering requires using open-ended questions. We talked about relationship building, and that does require affirmation, which is basically, affirming for people, like basically saying, that you've heard them, or that you're encouraging them, if they've done something positive. Reflections is another way in that we can be patient-centered as well, in that we make sure that we are like saying to people what we think we heard them say, so that they know we're acknowledging that we've heard them and we're paying attention to what they want. Same with summaries. That's also a patient-centered skill, is to basically reflect back what you're hearing from people, And then also kind of give them like a summary of like, okay, so today these are all the things we've discussed, and it sounds like this is what's going on, and that's what's going on with you. And it also allows the person to clarify if there's something that we've said that wasn't correct. So you'll see that there are, linkages between those concepts. So I just wanted to make sure that you all saw that and can actually apply what you learned in both settings, from the lecture as well as from the interviewing training, to help you work with clients. So next slide, we're going to talk a little bit more about the open-ended questions approach, because that's really what we're going to be working on today. So why open-ended questions? The reason we talk about it's how important it is to use open-ended questions and just not yes/no questions is because they really invite someone to think a little bit before they respond. If you ask someone to say, well, tell me more about, what's been challenging for you, they actually have to think. And really, they could respond in a variety of different ways, right? They could tell you about what's top of mind for them today. They could talk about the emotional component of it. They could talk about the physical component of it. They could tell you about, basically, how long it's been going on. That gives them a lot of opportunity to focus on what they think is most important. It allows them to tell you some of who they are, their story, and it would reveal more information about what they're feeling, what they're experiencing, and what might influence their beliefs and their behavioral choices than if you just ask them something where they can only say yes, no, or, I've been, yes, I've been taking the medicine. So that way you don't really have a good understanding of like, of what is actually going on with that person when you don't use open-ended questions. So that's why we really want to focus on that. And so now we're going to focus really on how we use these open-ended questions to gather data to basically assess patients' social needs, because we know that's a key piece of overcoming health inequities. Is we know that a lot of health inequities are driven by not just medical, but by social needs, okay? So we're going to talk about these social determinants of health. And so many of you already know that social determinants of health are the conditions in which people are born, grow, work, live, and age. And when these conditions are associated with negative health outcomes, so if they have poor housing or not an adequate access to healthy food, then we call those health-related social risks. So things that we know are going to make them sick, and not just something that is negative, but isn't really influencing their health, right? And then when people say they have a need related to that social risk factor, then that's a social need, right? So, I guess you could live in a house that has mold and maybe you don't have anything, you don't have a need related to it because that's already being addressed, But if the person says, you know what, it's really bothering me and I'm having like, my allergies are acting up or my asthma, then that is actually a social need, right? A health-related social need. So we're going to talk about these different categories of social determinants of health and how we talk about them to find out whether they're negative and whether they're actually a need that we have to address with patients and research participants or clients. So let's go through, and many of you probably have seen these screener questions. A lot of clinics are now using these social needs screeners where you can just ask questions and people can check off yes or no. Like, are you worried about not having a place to live? Are you worried about having enough food? People can check off yes, no, and then you might get the results of that screener, and it would be easier for you to determine, well, okay, I need to then probe further into like what the problem is or how I need to help this person address this problem. That's fine, but it doesn't really give you a lot of detail, right? Because if you just know the person has a problem, but you don't really know the nature of it, you don't know how long it's been going on. You don't know what they've tried to do about it. So, the point is that these screeners are helpful, but they don't actually, this is not a way that we engage in a conversation with people. We don't just want to ask them whether they have a problem or not, right? We really want to understand more about what the issue is. So, again, these are some of the yes, no sort of screener questions that you may or may not have seen. And now there are several places where they don't even have these screeners. So you may not even have the opportunity to know whether the person even has a problem with any of these things or not. So you would have to initiate a conversation about it with them in order to do that. So I would say there are two ways that you can use your open-ended questions. One of them is to follow up on screeners, but the other way might be to initiate conversations in general about these topics, that because you might not know anything about it without asking. Okay, so I think, again, these are more sort of yes, no screener questions. So hopefully many of the clinics are using them, but if they aren't, then you also have the opportunity to practice more of your motivational interviewing in your relationship and patient-centeredness skills to assess patient social needs. So we're just going to talk a little bit now. This is going to be a little bit more interactive, this part, because I want you all to start thinking about, when we think about addressing patients' social needs across all these categories, we're going to go through them sort of one by one. And instead of just saying, do you have any concerns about your medications or about your health, or are you worried about how much food you have, or do you have enough social support at home? We're going to have you sort of try to think a little bit about how you would reframe that as an open-ended question. So we'll do that a little bit now, and then you'll have the opportunity to practice it more with your cases. So let's go into that now. So I'm going to give you the opportunity to just sort of think a little bit about, if you wanted to talk with one of your research participants, your clients, about medical concerns. So that's the first category. What are some ways that you might initiate that conversation to get people to sort of talk and tell you more about what's going on with them medically, what concerns they might have? Anybody? Any takers on that one? And if everyone's shy, oh, good. I was going to say, if everyone's shy, we can give you, we can throw you like sort of a soft one. But yeah, so who, I can't see, but whose hand is up?
Oh, it's me, Sam. I think you kind of just had a really good lead in right there, right? You said what concerns you with your health, or even like a intro, like, oh, what brings you in today? And it really has the participant or the patient identifying why they think they are there. So that can be kind of the jumping point of what to start with, or what's their priority.
Yeah, absolutely. I think those are great. Those are great examples. What brings you in today? What concerns do you have? So Allison, do you want to show, or is it Christian who's running the slides, what examples we can make? Yeah, what worries do you have about your health? What concerns do you have about getting your medicines, or whatever other medical supplies you need, something like that. All right, so then we're going to move on to housing instability and housing conditions. How might you approach somebody about in an open-ended way to talk about their housing? Anybody else? Lindsay?
One thing when I do my baseline assessments, a question I like to ask is, what is your housing situation currently like today?
Mm-hmm.
Instead of just asking, oh, do you have housing? Yes, no, but what is your current housing situation like? And then, oh, I have a house. Well, then you can kind of break it down to, what type of problems are you running into, or are you having any problems? Things like that.
Mm-hmm. Okay, that's good. What is your housing situation, your current housing situation? What kinds of issues are you having with housing, if any, right? Anybody else? Or we can keep going. So Christian, yeah. So we said, tell me about where you live is another thing, or what, if anything, worries you about your housing situation. Okay. So yeah, let's move over to food. And this is an interesting category because we actually had some challenges with this one for some reason. So let's see if anybody has any ideas about open-ended questions about food. Sherelle?
Yeah, so this one can kind of be tricky because like people are really sensitive about this one. I will ask like questions about what are meals that you're eating regularly? What does that look like? Also asking questions about like what kind of foods, what kind of stores that's usually around you. These kind of questions also gives you an idea of what that person's eating, and etc. That's pretty much it.
Yeah. No, those are great questions. Yeah, what kinds of foods, what kinds of stores do you have available for food shopping? Um, yeah, we were struggling because we felt like if people might have food insecurity, like how would we bring that up in a way that that didn't actually act like we were like assuming something about them, ahead of time. So so you want to show, yeah, we said, so we said, well, tell me about what it's like to get food in your neighborhood, which is pretty similar to what you said, Sherelle, about, what kinds of stores do you have around you? What concerns, if any, do you have about what you'll eat on most days? Or how are you feeling about the price of food and the affordability of feeding your family? So how are you feeling about that, maybe, Um, there was one that I sort of came up with that was like, tell me about a time, if you've ever had one, where you're worried about running out of food. So we could say, if you've ever had one, so it's not like we're assuming that you have had that, right? And then people could say, well, I can't think of a time when that happened. Or, they would say, well, fortunately I'm not in that situation now, but, they might share with you that, that they had a problem in the past. So any concerns about any of these things? Oh, people talked about maybe also skipping meals, because sometimes we know that people skip meals, or they sort of cut the size of their meal, make it smaller because they want to make the food last longer. So we might say something about tell me about a time when you had to do that, or what worries do you have about being able to eat the way you would like in order to be healthy. So Lindsay, I see your hands up.
So following on to these questions, another question I like to ask is, do you have access to fresh and healthy foods? I actually encountered this with a patient who, talked about the price of food being really expensive. So she has a family of 5 and she often buys a lot of box foods, and she's not eligible for SNAP or EBT. And
Mhm.
my boyfriend actually does a delivery route, a food pantry route in Delaware, and she happens to have a relative there. And there's a local food pantry that anybody can show up to. You don't need to have any specific certification. So leading on to those questions, I ended up being able to, find that resource for her. She goes
Mhm.
there every week anyway, so that was a good connection to have.
Wow. No, that is really great. Again, well, I think that's an example of where once you've started the conversation with a more open-ended question, that you could get more specific about, like a yes, no question, like, do you have access to fresh fruits and vegetables? But you kind of have to, before you do that, you can imagine that you wouldn't want to launch into that as your first question, right? Because people would just,
Exactly.
why are you asking me that?
Yes.
So yeah. So that's a good example of an open to closed cone, sort of a process with questions.
Yeah.
All right, so let's move on to transportation. We got a sneak peek at that. Anybody got some ideas about how you would ask about transportation? Kind of feeling stumped? Okay, Sherelle?
Um, I will ask about like since I'm in the city, so I will ask about like any local bus routes near you, or how trying to think of another one. I will say that that's for sure. Local buses, any transportation like services, public transportation near this patient.
Mm-hmm. So yeah, but you can see how hard it is to come up with just a way of approaching this broadly without like saying how close do you I live on a bus line, which is like, yeah. But so yeah, so I see
I guess
some
you could
mixed
say, you could ask them, how do they get around?
okay. So yeah, how do you get around? That's Marquita. I see Sam and Katie have their hands up.
Yeah, I was gonna say, I feel like this is a good one to loop in with other questions. So if you're seeing somebody in person, how did you get here today? Or if you're talking about groceries, how do you get your groceries? Are you like able to get everything back okay? Do you take the bus? Things like that. So kind of looping it in with whatever other questions you're asking or where you are.
That does make sense because yeah, a lot of times in order to get food or to get housing or to get medicines or whatever, transportation might be part of that. Yeah. Katie?
I was going to say something similar, saying like what type of transportation do you prefer? You know, like just to see if they're catching like the local transportation or they drive, either participant or client, just like they have a conversation like their means of getting around. I definitely would ask that. Or like, do you have good public transportation in your city, if they're like in the inner city or, depending on where they're at. But that I would definitely ask questions like that.
Okay. All right. So that's, these are all great ideas. Again, trying to allow people to talk more. So I think we can show some of the examples we came up with, which are, I think you guys actually came up with too. Like, tell me how you get around and how do you get to work, to your appointments, and to the store for shopping, as an example. So the next category is about employment. What might you say to people to learn more about their employment? I know some of these are a little harder than they're not hard, but you sort of have to think a little bit.
Well, could you say, hey, tell me about what type of work you do?
That's a great one, Katie. Yeah. So tell me about what kind of work you do. You want to show our examples, Christian? Yeah, tell me about your job. Like, what do you like best about it? What worries do you have, right? Okay, this one is the next category is on social and emotional support. So there's also, it's not just support, but also like safety, right, of the people that you live with. So what kinds of things do we ask people about that? I see Carmen and Lindsay. Oh, Lindsay. Carmen, you put your hand down.
Yeah, my comment was on the one for employment.
Oh, okay.
So just quickly, sometimes I ask people how they spend their day, because there are some people that are not
working,
formally
right?
employed. So if you were to ask them if they have a job, they would say no, but then they do other things for income, like sell goods, take kids to watch kids, or pick up kids from school or daycare. So people have their way of making a living. And if we ask more broadly how they spend their day or how they may earn money, we can also get some other details.
That's great. That is a fantastic suggestion, because again, not everybody's working outside the home. Not everybody has like a traditional job. So I think, oh, Lindsay, your hand is up. I think about the social and emotional support part, right?
So yes, for the next category here, one question I was going to suggest that I usually ask is, are you satisfied with the types of relationships you have with your family members and friends?
Yeah, so that's a great question. It is a closed question, so they might just say, yeah.
Well, yeah, that is true.
Yeah. Sam?
Being a pharmacist, obviously, a lot of times we're looking at medicines and seeing how I can best help there. So that in itself is its question, how can I best help you today? What can I help you with? And that opens the door for whatever that might be that might help them at that time.
Okay, how can I help you today? Okay. All right, so we're going to show our examples, and I think because we're running, I think this is good, but I want to make sure we have enough time for you guys to apply this to your cases, or we might go through the next few pretty quickly. So we came up with, like, what do you do when you're going through a tough time? Like, or who do you turn to for support? Like, if you were to pick one word to describe your home, what would it be? Because we want to see whether people are going to say, oh, it's comfortable, it's safe, I feel happy, or if they say stressful or something like that, that lets you know that things are not that smooth, right? All right, so we're going to go through the others, and I regret that we're going through these pretty quickly, but this one is around discrimination, or feeling being treated unfairly. So Christian, do you want to just show what we came up with here? Tell me about a time when you felt that other people treated you unfairly. And we could say because of whatever aspect of your identity, or for whatever reason, you felt like you were treated unfairly. And then let's go to the utilities one. This is like, what needs do you have related to electricity, water, gas, internet, etc.? So it could be just, what needs do you have? So I think that's our last example. Before you all, we take any questions you have. I think this was great. Thanks for all your participation and engagement. And I think you all have a lot of experience. And I think one of the things that it's sometimes, especially when we have limited time, it's tempting not to ask open-ended questions because we know people are going to talk more. At the same time, I think there's a lot of research that shows that, yeah, actually, if we don't ask those open-ended questions, we don't get the information we need. And then sometimes people do, what they do is they'll tell you something on the way out the door that's like a major thing that you wish that you had asked them about before, because like now you're done with the appointment, but now they just told you that, that actually they're being evicted and they have nowhere to go. And you're just like, oh, like, so it does save time in the long run. So any other questions before you all move into your breakout groups? It was great seeing everybody and hearing from you. Nope. Okay.
I can share my screen and we'll give a little overview of what to expect in your breakout rooms, and then we'll head into them.
Yeah, so as we have now said 3 times, we're going to break up into our groups, and we're going to review and discuss some scenarios that can happen in our roles as interventionists with patient encounters. And so we would like you to review the scenarios and discuss how it connects with the videos and the presentations that you've viewed up to now. And we would also like you to reflect on the perspectives of the main actors in the scenario. So why did the CHW respond in the way that they did? What were they thinking? Why did the patient react this way? How might they have received what was communicated? A lot of times when we can have an appreciation for the different perspectives and with people that we're interacting with, it can increase our empathy and help us better problem solve the conflicts that we may encounter. And then we would also like you to role play if we have the time for it, and practice how we may communicate with patients in these scenarios, or think about things we might have done differently for a more desirable outcome. All right, and then we'll come back together and debrief. So we are breaking up into rooms 1, 2, and 3, and Allison is going to make us magically appear in our next rooms.
Yes, I will do that.